Hi, everyone. Thanks for joining. We're just going to give it a few seconds while people are rolling in. All right. So hello, everyone, and thanks for joining us today for NextGen and IMO Core, Enhancing Diagnoses Faster. My name is Jordan Leibitz. I'm part of the marketing team here at IMO Health. And before we get started, I want to take care of a few items for those attending. First off, this webinar is being recorded and will be available for you for future viewing. All attendees will be in listen mode. So if you have any questions or comments, just type them into the question section on your Zoom control panel. Today we have Dr. Sarah Weirs. She is a physician at Family Healthcare, and it is a FQHC based in Michigan. And then from IMO Health, we have our Senior Manager of Customer Support, Josephine Carson, and our Director of our Discovery Product, David Arco. So without further ado, I'm going to pass it on over to you, Josephine.
Thanks, Jory. Hi, everyone. Thanks for being here, and thank you so much, Dr. Weirs, for being here and joining us today. Could you please introduce yourself and just explain your role within family healthcare?
Sure. Hi, everyone. I'm Dr. Sarah Weirs. I'm a family medicine physician, and like Jory said, I practice at Family Healthcare. I'm in the White Cloud location, which is on the western side of the state of Michigan, a little bit north of Grand Rapids, if you guys have heard of that city. I've been at Family Healthcare for the last 4 years, and we use NextGen, and I've only ever used NextGen with IMO Core embedded in it. I've never known the dark ages without it. And I find it to be a really helpful tool. So I'm happy to be here to help talk about it today.
Yeah, so like you mentioned, Dr. Weirs, you've been using IMO Core for your patient documentation for many years. Which features do you find the most valuable right now?
I find it helpful to be able to do a lot of my chronic documentation, like the chronic problem documentation within IMO Core. I can do my HPI and my plan in one screen. I feel like it helps me capture more documentation. Oh, by the way, I need a refill for my hyperlipidemia med. Whereas if I was just doing it outside of IMO, it may not have ended up having an HPI. And then being able to manage the problem list more effectively than the way just pure NextGen does. It's a lot cleaner.
Yeah. So Family Healthcare has been partnered with IMO Health since 2011. So your organization has actually really been with us since the very beginning. So from when we solely just provided a lookup tool of just to search and capture diagnoses. Then as our product evolved over time and we started introducing problem list tools and being able to document the HPI note and being able to, kind of clean up the problem list, Family Healthcare has just continued to partner with us and utilize those latest features that we've introduced. And as you know, Dr. Weirs, and for everyone on today's webinar, we have been working on a brand new and improved IMO Core platform to really help just continue improving some workflows within NextGen EHR. And you have so graciously partnered with us and helped give us feedback on what we should be doing as we continue to evolve IMO Core, what we shouldn't be doing anymore. Could you just share with the group what your experiences with partnering with us while we've been working on this and what you're most excited about?
Yeah, absolutely. So I definitely want to say it's been a lot of fun partnering with you guys. I love how open you are to feedback. It feels really exciting to be on like the cutting edge of, when we're in the workflow, seeing patients documenting, there's always those things where it's like, oh, I wish I could do that. And to actually have someone to work with and say, hey, this is what we're wishing for. And then to hear, yeah, okay, we'll do it. We'll make it happen. You guys have been amazing. And working in IMO definitely is super important for overall safety of our patients. The focus on the problem list is so important. And I can share a story recently. I was seeing a patient on Friday, made me think of how important it is to have the problem list. I saw a patient who had been seeing a different provider who has since retired, and she hadn't been back into the office for over a year. And now she was coming to see me for the very first time, needed refills on all of her meds, and nothing on it. But she's got 12 different medications and clearly a very complex medical history. And I can tell that the provider that was seeing her before didn't really work with the IMO Core tool to build a problem list. They were sort of the old school, relying on the NextGen, grabbing the problem and just documenting at the time of the visit, and not really relying on the tools of IMO to build the problem list. And so I do what I always do. And I'm like, all right, we're going to build your problem list and we're going to use the IMO. And I'm very, very careful about doing that, because if someone is seeing a patient they've never seen before, this, you have to rely on the problem list to know, what is this person dealing with? What are the safety points for that? So especially in a group practice, you're passing patients around, we really, really need to have those problem lists accurate. So I appreciate how IMO helps so much with that.
Thank you for that. And that's why it's been so great to partner with you, because you really understand, what the importance of what we think of the problem list too, and what we're trying to do to make it easier to understand what's going on with your patients. And speaking of feedback, Dr. Weirs, before we jump into, the demo and showing everyone the new IMO Core platform, could you also just share if there's any challenges you've been facing and maybe what you wish IMO Core did today that hopefully this new platform will do?
Yeah, absolutely. I think anyone who's used NextGen knows that there's a lot of slowness. And unfortunately, IMO does have slowness with it too, and some trouble loading some of the templates. You open the problem list sometimes and you kind of have to mouse over to get things to pop up. And it's the nature of that sort of template, embedded within templates. From what I've heard from you guys, I'm kind of learning the technical part of it. And then people who haven't quite used the problem list accurately, where they have acute problems on the problem list, and just having to go through and clean that up. There's a lot of clicks to get through to doing that. So I'm looking forward to maybe cleaning that up in the future.
Yeah, and all of that you've shared with us has really been in line with what we're hearing from other clients as well. So of course, we want to be able to address that and improve it. So without further ado, we would love to show you all what we've been working on and what's to come at the end of this quarter for all IMO Core clients. And I'm going to kick it over to David Arco, who is going to walk through our newest IMO Core.
Thanks, Josephine. And thanks, Dr. Weirs. Thank you so much for joining us today and for being a great partner in helping us get this new platform off the ground. Your feedback's invaluable. As with all of our NextGen customers, we appreciate your feedback and your partnership over the years, and look forward to continuing to drive additional value to your organizations. So without further ado, let me show you what we've been working on. Is it screen? There we are. There's my NextGen screen. Josephine, can you give me a thumbs up if you can see it? Look good? All right. So for those of you who are, if you're not familiar with our IMO Core platform, our IMO Core template, it expands on, as Josephine was mentioning earlier, when we first got started in NextGen, what we were supporting was just better search and capture of your billing codes. It was really around helping your providers get the ICD-10, at the time, ICD-9 codes that they needed to get paid in an easier way, with clinician-friendly language, search terms that they could easily find what they were looking for, not having to know that ICD called a STI ordeolum externum, being able to search with their common clinical vernacular and find the code that they needed. Essentially helping providers be providers and not have to be coders. But as we evolved, we recognized, hey, there's lots of opportunity, a big challenge, and not just NextGen, but every EHR are problem lists. And we recognized that there were needs to solve there, that they're just hard to manage in the EHR. So we've built out a suite of tools for better problem list management. And the first of this, some of you are already using today. IMO Core includes a categorized problem list that organizes problems into clinical specialties. So the first step to better problem list management is just understanding what's going on there. rather than a laundry list of conditions, or maybe having to look at your previous visits and seeing a bunch of acute conditions mixed in there as well. Having a well-organized list of your patient's chronic conditions can help you get up to speed, as Dr. Weers was saying earlier with her anecdote with a patient. Understanding that patient's clinical story and all of their chronic conditions, especially if you haven't seen them before, getting a starting point of what's going on with this patient and orienting the encounter and your care to what that patient really has going on. So we think the problem list is the right tool for that. Now, as Dr. Weers and Josephine mentioned, a lot of our problem list tools aren't being fully utilized today due largely to performance issues. We built all of our solutions in NextGen's template editor. If you're familiar with that tool, it's been around for a decade or more. As long as I've been at IMO, I've been working with that NextGen template editor, and we've really maxed out what it's capable of doing. And as a result, there are some performance issues, some stability issues with our template, and we knew we needed to solve those things for you to really be able to utilize all of the features that IMO is able to deliver. So what we did was we worked with NextGen Corporate to get access to their APIs. And we're working with their API program to build out essentially a web app that can plug into a template, but it will look more or less the same, but behind the scenes, we'll be using NextGen APIs rather than template triggers and queries and stored procedures that were really the performance bottlenecks. So you'll have a much more performant and really kind of more cohesive workflow, rather than, you can kind of feel some of the clunkiness in the old template as you're moving stuff around. There is some weird clicks and various stuff going on. This is all kind of a relic of the template components that we use to build this thing. So moving into a web app is just going to allow all those features to just work much more smoothly. So let's say I want to address this patient's CHF. I can click that, and when I do, IMO is going to recognize, hold on, this problem needs more specificity for billing purposes. When you add a diagnosis to the encounter, you need a bunch of detail that ICD-10 requires. And to help you be able to capture that, we will actually prompt you with a couple of questions. Whatever detail ICD needs, we'll ask you the question to get that detail. So you don't need to be a coder. You don't need to know the whole ICD-10 structure. You just need to be able to speak clinically about what's going on with the patient, answer those questions, and you can get the right diagnosis onto the problem list or onto the visit diagnosis with the appropriate code so that you don't get hit with a coding query later, so that claim doesn't get denied, so that you get the appropriate reimbursement for treating that patient. You can also, with the new, in the new IMO Core, you'll be able to update the problem list with that detail as well, so in the future, you don't get asked those same questions. Now, a lot of people are focused on Medicare Advantage these days and getting the right reimbursement, the right RAF scores for your Medicare Advantage patients. There's a huge and growing part of most of our clients' payer mix, which is coming from Medicare Advantage patients, which are reimbursed a little bit differently. Rather than fee for service, it is fee for value, which is essentially helping manage patients' chronic conditions and try to keep the cost of that care down by managing these chronic conditions over time so they don't become more severe. So there are certain conditions that are part of this Medicare Advantage model that affect that patient's reimbursement, again, largely chronic conditions. And a lot of you are probably familiar with these already, but we flag those within our application, within the template that you'll be using, so that you can identify those conditions that for a Medicare Advantage patient will affect their reimbursement. Further, we color code those flags to tell you whether that condition needs to be addressed or whether it has already been addressed and you're already getting your reimbursement for that particular condition. So here's another example, diabetes. Diabetes, lots of detail. It's not enough to say that the patient's a diabetic, E11.9. That's not enough anymore. You need to document any manifestation or complications. You also have to document the insulin status, whether the patient is using insulin. But you don't have to, again, with IMO Core, you don't have to know all of those little details. IMO is going to make sure that you capture the appropriate detail. And yes, they are some clicks, but they're meaningful clicks for a couple of reasons. And as I work through this, notice what happens with these modifiers. IMO asks you the question. ICD wants to know about whether this diabetes has complications. And as I indicate what type of complications the patient is presenting with, notice what happens with the next set of questions, the complication details. If this patient has kidney complications, notice that a bunch of those other complications went away, and I'm only left with those relevant to kidney complications. So if it's CKD, now I'm going to be asked for staging, and now I've got a fully specified ICD-10 code and secondary codes, because I also need a code for the kidney disease. I also need a code for the insulin use. IMO is going to give you all of those codes at once, so you don't have to remember to go code those secondary conditions as well. And notice that they're all HCCs. They all have those flags. That means they all are impacting that patient's reimbursement. So if you had just captured E11.9, you would be getting about a fifth of the reimbursement you would be with E11.22, diabetes with complications, and kidney disease and insulin use. So there, those clicks that we're asking you to do, meaningful clicks, more reimbursement, and fewer coding queries from your coding team, and fewer denied claims. All right. So all of the coding tools roughly the same as what you were using in your current IMO solution, whether you're on Problem IT Plus, IMO Core, whatever version you're using to code with IMO today, all of those coding workflows are going to be very similar to what you had before, just a bit more performant and user-friendly. But let's talk a little bit about, another search feature. A lot of providers don't like to search, they like to manage a favorites list. We are supporting a favorites list in the new template as well. Those favorites will be hosted here at IMO, which means we're able to organize them for you as well. We've gotten some feedback from providers who use the favorites list in the IMO template today. They're like, you know what, we love the categorization of your problem list. Can you apply that to the favorites list too? Well, now we can. So your favorites will be organized in terms of clinical specialty. So for a primary care doc, you can kind of organize your thoughts here. If you're a specialist, you'll be able to zero in on where your favorites are. All right. Now let's talk about problem lists. We started talking there. Dr. Weir shared some feedback, and I talked a little bit about how important we think this is. So organizing the problem list is just step one. Lots of your problem lists are likely either cluttered with unnecessary problems, maybe an appendicitis from 10 years ago, or a pregnancy from 5 years ago, something that is once maybe relevant, but no longer relevant today, but it's still just taking up space. And it's just noise on the problem list, making it harder to use. Well, we now have a tool that can help with that. In addition to organizing the problems, we can also identify problems that can be removed. So we will look for common types of clinical or of problem list clutter, those acute conditions that based on their onset date are likely no longer active. We find those for you and call those out so you can quickly remove them. Second type of clutter that we often see are duplicates, the exact same condition added twice. No reason to have it there multiple times. We already know the patient has lower back pain. I don't need that documented the second time. But lots of times, if a provider doesn't have a well-organized problem list or doesn't do a thorough review of what's there, they might be adding a problem that's already there. And we see that an awful lot. And the third type of clutter we look for are related problems. We're talking about the same underlying condition, but with different specificity or severity that might mean different ICD-10 coding, even different SNOMED coding. This is why it's hard for EHRs to clean up problem lists, because to a computer, these look distinct. They all have different codes associated with them, so they don't look like duplicates or redundant entries to the computer. But to you, the provider, you know that they're redundant and actually kind of conflicting because they have different information. Again, we can identify these unnecessary problems, the noise on the problem list, it doesn't need to be there, and we can make it much easier for you to get those things off the list. Are you sure? Yep. And now I've got a nice, clean, concise problem list. And now the flip side of that equation is missing problems. Dr. Weirs mentioned this. She had a patient who had basically nothing on their problem list because the previous provider wasn't managing it. So where do you even begin? How do you begin to populate that patient's problem list if you don't have a starting point? How do you orient your encounter if you don't have that clinical picture to work with? Well, the new IMO Core app will also have suggested additions to the problem list. So we will look through, as we're loading the problem list, we'll look through the patient's history for chronic conditions that were mentioned in a previous encounter and actually put onto a visit to go out on a claim. We know they're chronic, but they're missing from the problem list, so they should be added. So we can call them out here in a pretty streamlined work queue so that you can review these. And notice that a lot of them are HCCs. So this is impacting reimbursement as well as patient care. So getting these documented on the problem list, one, will help you in the future when you prepare for this encounter, see this patient, know that patient's clinical story without having to go dig through previous encounters. And two, if it's a Medicare Advantage patient, you're going to have visibility to those HCCs so you can make sure that you're getting them readdressed and make sure that you get the appropriate reimbursement. So pretty straightforward workflow here. If this patient has recurrent major depressive disorder, yes, click the plus. Maybe the opioid abuse, maybe the patient is recovered, no longer need this on the problem list. I don't want to add this one. I can click the no symbol that will dismiss it. It will suppress it and we won't add it to the problem list. Now, notice that we're not just looking for HCCs. This is not just a rev cycle tool, although that is certainly important and we want to support that and make sure you're getting the right reimbursement. But when we built this tool, we're looking at the clinical problem, which is important chronic conditions that the provider should know about to orient their care that are missing from the problem list, so the provider wouldn't have them in their head as they're preparing for that encounter. So this rules engine will also find things like this atrioventricular septal defect. I can click the plus and I can add that as well. All right. Now, notice as I clicked on this tab, I'm going to unclick it for a second. Notice that as I look over to the right, under the coag and thromboembolic section, I have on warfarin now. But as I click the suggested additions, notice that the primary thrombocytopenia appears there in italics. This is not on the problem list yet. You have to take an action here on the suggested additions tab. But by clicking the plus button, it will add it to the problem list. Now it is actually there. All right, and notice that on those tabs, when we have identified cleanup suggestions or identified suggested additions, there will be a little badge, a notification to alert you that there's something to see there. Click on that tab to see what IMO is recommending. Be a good steward of the problem list. Do your service to your colleagues and keep your problem list clean because you're not the only one looking at them. So check out the problem list cleanup tab. We're actually, in my demo, it didn't do this, but we are going to pre-select most of those things. So it's more of a review and approve. Review the things that IMO has teed up and then click that big blue button that appeared at the top and that will remove them all. If you see suggested additions, click here, see what these are. And if they're still active problems, get them added to the problem list. Now, there are a number of things that this is going to impact besides just making it easier for you in your future encounters with this patient. The data on the problem list drives all kinds of things throughout the EHR, whether it's population health or decision support or quality reporting, and these risk-based models that reimburse you for your management of chronic conditions. All of those things are impacted by the accuracy and completeness of your problem list. So this is a really important tool. Be thorough about reviewing what IMO finds here and get the appropriate things onto the problem list so you have that full clinical story documented. Now, a few more comments here about the suggested additions. All of the suggested additions that you see here were coded in a previous encounter as an assessment or a visit diagnosis. But that's not the only place we might be able to find missing chronic conditions. This application is going to support identification of not just problems coded in a previous encounter, but we also have the ability to look through clinical notes, unstructured text. We have natural language processing capabilities here at IMO that can review unstructured text, find chronic conditions mentioned there, pull those out and add them to this queue as well. Now, the NLP processing is not part of the base IMO Core package. NLP processing costs are not free, so we need to make sure we're covering that. So there would be a license required if you want us to look through clinical notes and pull suggestions out of there. We can also, IMO is also in the process of building out partnerships with payers across the country, because in these risk-based contracts like Medicare Advantage, payers have a vested interest here in helping you succeed as well, because payers and providers are really working together to manage those patients and make sure those chronic diseases don't become worse and lead to higher costs. So payers want you to succeed here as well. So payers are partnering with IMO specifically for this functionality to be able to present gaps that they have identified. Maybe they know from another claim in another EHR that a patient had another chronic condition, another HCC. They will share that information with us, and if that patient loads in our app, we will present the payer suggestions in this workflow as well. Now, good news about the payer integration, that's no cost to you. We will partner with your payer to get those suggestions integrated. We really just would ask an introduction to the payer that you want us to partner with, and then we can take it from there and work out the details to get those payer identified gaps integrated into this same workflow. All right, so talked a little bit about cost. Some more good news here. This new version of IMO Core, we are going to be offering to all of our existing clients at no additional cost. So your current IMO Core license will cover this new upgrade, no additional cost. We will require a BAA, a business associate agreement, essentially just to cover the data sharing. As we use the NextGen APIs, we're going to see patient PHI. This is nothing new to us. We do this in most of our major EHR partners. So we're well versed in handling PHI appropriately, HIPAA compliant, all of that good stuff. Happy to talk that through with your security teams if you have any questions, but we will need a BAA in place just to govern that data sharing. All right, so those are the kind of the high level new feature updates that I'm able to demo today. Where are we in this integration? So as you can see, this web app that I've been using in a browser here, this is live. This is what our engineers are working on right now. We are to the point where we're ready to integrate with a NextGen client. And Dr. Weirs and Baldwin are going to be one of those testing partners. We have a half dozen identified that we'll be working with over the next month or so for integration testing. Once we are through that integration testing and we have accumulated all of their feedback and made any tweaks that they feel might be necessary to the app, then we will make it available to our entire NextGen customer base. So expect that in probably somewhere around the turn of the year, late December, probably early January, when this will be available for the general market. All right. Some other items that are on our roadmap that I did not demo here. One that we just talked over with Dr. Weirs and she's really excited about is the ability to not just organize the problem list and improve the accuracy and cleanliness of it, but also to make it more useful by making it kind of putting other clinical data in the problem list context. If you're familiar with Dr. Larry Weed and the problem-oriented medical record, we're big fans of his here, and the problem-oriented medical record actually predated the EHR. It was a kind of a way of thinking about the patient's medical record around the problem list. So that you start with the problem list as your lens, and then you view the rest of the patient's history through that lens of the chronic problems that you're trying to manage for that patient. We love that idea. And to that end, a feature that will be coming into IMO Core in the next couple of months is linking related medications and lab results to problems on the problem list. so that rather than having to review all of this data in silos, and then as you're writing your note for trying to pull all this data from various places, you'll have it all in the problem list. You can click a problem, and when you click that problem to see notes or associated dates and codes and such, you'll also be able to see related meds and labs right here, but just the meds and labs that are relevant for this CHF. So this is just going to be again, we're always looking for ways to make your providers' lives easier, save them time, clicks, navigating through the EHR, give them the data that they need kind of at their fingertips. So we're excited about this feature as a way to kind of cut down some of that jumping around and looking at out of context and unorganized data, helping you be able to kind of organize your thoughts and make it easier to get that note generated. All right, I think that's the big one. We're at about a half hour. Want to make sure that we save time for questions. So, Jory, I'm going to hand it back to you, and maybe we can open it up for some panel questions and discussion.
Yeah, that sounds great. Yeah, so we'll be kicking off our live Q&A. So put any questions you have into the question section on your Zoom control panel. I see that we have a few already coming in. One being, I am a current IMO client. How can we stay up to date with new releases? And what is the process to confirm we are on the latest version?
Yeah, I can answer that. So Victor, what we can do is follow up with you right after this. We do have specific employees from your organization that are assigned to be notified each time there is a new release. So what we can do is make sure we have that list accurate and correct, and that you are the right folks that are getting notified when we have a new release. And these notifications will also help you determine like your current version that you're on and what the latest version is that's available to take.
Awesome. All right. When are these enhancements available? I think you mentioned it earlier, but maybe you could talk about that.
Yeah, we don't have a release date set yet. We expect to begin integration testing in November. And depending on how that goes, we expect that to be probably about a month of testing, and then assume maybe another month to incorporate feedback. So we're looking at an early Q1 general availability.
Okay. And then what is the process for onboarding the API application?
Yeah, great. This is a great question. So because we're changing a little bit how we're integrating with NextGen, you will need NextGen's API developer suite or API suite. Do you remember exactly what it's called, Josephine?
API suite installer, I believe.
API suite installer. Yep.
Yeah.
So there is a free download from NextGen for that. Our understanding is there's no cost to get that installed. And once you do, that will enable the APIs that our app will be using.
Okay, another came in regarding payers. How many payers are you currently connected with? Commercial, private, or public, or both? I don't know if you're able to answer that.
That's a great question. I can say that our first payer integration in a different EHR is going live. They're starting their pilot as we speak. So we have one active integration, and we have a number in the works. Our payer team has several dozen payers that they're working with right now, but we don't have any live. We're sort of waiting for the right partner to right provider partner to turn this on. So our payer conversations are a bit more developed than our provider conversations. So if this is something that you're interested in, just get us in touch with your Medicare Advantage payers, and we can take it from there.
Can I jump in with a question?
Yeah, absolutely.
So when you were showing adding the diabetes diagnosis from the problem list to today's assessment, and you were defining it and making it more specific, I know that there's the button to just add it to today's assessment, and then the button below it to add it to both the problem list and the assessment.
Yep.
I do want to add, I love that that is there as a choice after you get started adding the diagnosis, because sometimes I'll start searching for a diagnosis and be like, oh crap, I have to change it to the both tab, and
Yeah.
and I'm like jumping back to do it. So I love that that's in one place right there when you're already refining the diagnosis. My question is, as it adds like the long-term use of insulin and the CKD diagnosis to today's assessments, if you were to hit the both button, like the left and right, would it put the long-term current use of insulin and the CKD diagnosis on the problem list?
Great question. No, it would not. No. So when we add to the assessment, we will give you a line item for each ICD-10 code that you need. So there will be the selection that you make is the first one, what we call the primary code, and then any secondary codes will be added subsequently in the assessment list. But if you're adding to the problem list, we will just give you one record for the problem list, the full term, the diabetes with CKD with long-term use of insulin, and you won't need the second ones because it's all encapsulated in that one problem.
And so if I had updated it and made that on the current problem list, and then in future visits, gone to my problem list and hit add to assessments, would it then automatically load the other line item codes for the assessment?
Yes, absolutely. Because you have that very specific problem record now on the problem list, type 2 diabetes with CKD, with insulin use. Then in the future, if you just add it to today's assessments, all codes would just automatically go to today's assessments.
Great, great.
Yes.
And I had one other question about that. Let's say I have a patient who has diabetes and they have kidney complications and ocular complications. Do I need to go in and add that as a separate diabetes diagnosis? How do I get different organ systems problems? Because you know how it collapses when you start selecting things.
Yep. Yeah, that is a great question. And that is a problem we haven't been able to solve. Because there are so many diabetes codes and so many diabetic manifestations, impossible combinations, we just haven't found a feasible way to create all of those possible permutations without kind of just exploding, you know, what would be available in our search. So that's a nut we haven't been able to crack yet. But we can make sure you get the first manifestation documented. Any subsequent ones, like let's say there were macular edema as well. You get the diabetes, you get the CKD from the diabetes search, but then you would have to search again for the macular edema. Yeah.
And that reminds me of one other thing. I think I may have asked this to Josephine in a previous time we talked, but right now you can't add the same ICD-10 code twice. So it's got different words associated with it, like screening for lung cancer, screening for breast cancer, screening for colon cancer.
Yeah.
But they may be the same Z code. Right now you can't add them twice, but is it correct that in this new iteration, we're going to be allowed to add things multiple times to represent sort of the various things that people may have refused to do?
The rule for the duplicate assessment is actually not an IMO rule. You can't have two of the same ICD-10 codes, even if they have a different description on the same encounter. So while IMO may have multiple, and we have a ton of ICD-10 or a ton of descriptions for different types of encounters, but even though it has a different description, if it still maps to the same ICD-10 code, you can't have it twice in the assessment list.
Okay.
So even if they look different to you, they will look the same to insurance, and they'll kick that back and say, no, that's a duplicate ICD-10 code.
Okay.
Not IMO's rule, unfortunately.
Yeah, Dr. Weirs, because we were taking a look at that demo link. Once it's actually embedded inside NextGen, it'll behave the same way you're seeing it today, where a duplicate ICD-10 code cannot be added on the same encounter.
Yeah. We will allow you to keep multiple on the problem list. the first time we'll flag it as a duplicate. We'll say, hey, wait, you've got two encounter screenings here and they're mapped to the same code. But if you say, you can override our cleanup suggestions and say, nope, IMO, I meant that. I want both of those iterations there. I've heard some providers who say that like they intentionally do that with a UTI. They might place it there multiple times, and when they get to the certain number, when they see 3, okay, chronic, right? So we know that providers have some use cases where they might want what we would generally consider clutter on their problem list. So we're not gonna, we're not gonna implement a hard stop that says, hey, you have to remove this. It's your problem list. You can do what you want, but we're just providing those recommendations. But if you tell us, no, I meant to do this, we will remember that in the future. We won't alert you to those things that you want on the list.
So is that, no, I meant to put that on there, the check mark in the cleanup tool? Because I know there's like the little check box that you were checking and that got rid of things. And then there's a little check mark and then a little trash can. Sorry, I'm getting a little really detail oriented, but just curious, how do you make that work in the new IMO to say, I want to leave that on there?
One moment while I boot this up.
Sorry, I probably should have asked this when you had that screen open.
No problem. I'm just resetting my test patient here. Okay. That is still a coming soon feature for you. Let me show you in a different application. Very similar.
Josephine, while David's doing that, a question came in. Is this going to be accessed via the launch external application trigger in NextGen?
Yes, as of right now, Tom, that is how it is currently launching within NextGen sandbox environment where we've been doing the development. But now we're at the stage of trying to also figure out how it can launch from buttons or links that you already have today and how you're launching IMO today.
Nice. All right, David, are you ready, or we have a few questions that we can go into too?
Yeah, let's take some questions.
Okay, this is for Dr. Weirs, actually. So how have you gotten your providers to use these tools?
So, thank you for asking that, because I was just thinking about how we have a new provider that just started with us about a month ago. And as he was learning how to use NextGen, I've been nudging him every time I come over. He's doing some charting and I'm like, hey, I see that you're doing it this way. Let me encourage you to do it a different way that's going to be easier for you. Click that button, open up IMO real quick. And then I show him, wow, look, you can do your HPI and your assessment all in one screen. Look how easy that is. You can click this button right here, get that on the problem list. So just guiding the providers to show them, look how much easier it is to get everything that you need documented in one space. And we actually recently made a transition from when we click on our assessments button in NextGen, instead of opening the NextGen assessment screen, it takes us directly to IMO Core, so that you have to take an extra step to get back to the old NextGen assessment screen. So it sort of pushes providers to do it the right way, as I call it, to do your documentation within IMO Core. And I tend to have a pretty efficient workflow. So our CMO has decided that anytime we have a new provider start in our system, he wants them to shadow with me and learn my workflow. And so I've just been teaching every new provider that starts with us to do the documentation within IMO Core, and everyone seems to love it.
That's awesome. And that speaks to who you are as a physician too. You're a good trainer. Okay, David, are you ready? Or we have another one for Dr. Weirs if you want.
Yeah, let's keep rolling.
All right. What changes have you noticed in the accuracy and conciseness of patient records?
With using IMO.
Yes.
So I'm fortunate enough that I never had to use NextGen without IMO Core. So I don't know what it looked like before we had it in general, but I do know that since we made that shift that I was talking about with that sort of forces people to get to the IMO screen as the first step when you're doing your documentation instead of automatically going to the old NextGen assessment screen, there is a lot more improved documentation, especially of those chronic conditions like the, oh, by the way, I need a refill on my allopurinol for my gout. It's so easy to just put the ICD-10 code in and just say, I refilled your allopurinol, but not have an HPI. But if you're in IMO and you just add it from the problem list, click on the diagnosis, you can do your HPI right there in that same screen. And it's just one sentence, you know, stable, doing well, hasn't had a flare in over a year, takes no extra time instead of having to go all the way back to the HPI area of your SOAP template, add that diagnosis and put it's, you know, things that were previously not there. I supervise 7 APPs. And so I do 5 chart reviews every month for all of them. And since we made this change, one of the big things that I'm giving them in terms of feedback is really nice job doing all your documentation. There's an HPI for every ICD-10 to support your plan. And I think it's because of we're using the tools within IMO Core a lot better.
Very good. Joe, this might be a question for you, but oh my gosh, if I can get my words out, that would be great. Do clinicians use IMO Core in conjunction with NextGen's mobile ambient assist or the speech to text function in NextGen Mobile Plus?
Yes, so sort of. The IMO Core, the new IMO Core platform that David just walked through and showed is actually going to be used with the desktop application of NextGen, not actually with NextGen Mobile. But NextGen Mobile's ambient assist is already powered by IMO terminology as well. So I think there's a part in there in ambient assist where the diagnosis code is actually captured. That is IMO terminology powering that. And the speech to text function as well. Yes. Good
Awesome.
question.
Thank you. All right. It looks like we're about going to wrap it up. David, did you want to share anything?
Yeah, just so y'all know that we're not blowing smoke here. The dismiss feature. So this is how you would dismiss a problem. This is a different application, but it'll be a very similar concept in our NextGen app. If I want to leave this acute chest pain on the problem list, I'll be able to say leave on PL for now, like leave it for this encounter, alert me next encounter so I can think about it. Or I want to leave this on the problem list indefinitely. I mean this to be here. Don't warn me about it in the future. So when these features are used, we actually log this back to our clinical team too, so that we can review what providers are doing with our suggestions. And if there are things that providers are constantly saying, leave this on the problem list, leave this on the problem list, then we know, oh, we need to tune our rules engine, and maybe we're flagging things that we shouldn't be. So we're constantly monitoring that and trying to improve the accuracy of what we're suggesting here, and taking cues from our users in terms of what's useful and what's not.
Nice. All right, so we are going to go ahead and close out today. Thank you so much for joining. I know there's a lot of other ways you can spend your workday, so we really appreciate you. I want to give a shout out to our awesome speakers today, Dr. Weirs, Josephine, David. Thank you so much. And if you're headed to Nashville for UGM, please come and visit our booth at 119. We'd love to see you. And I hope you all have a great rest of your day. Thank you so much.
Thanks, everyone.